don't know about this mask.
That's your call. I like it.
Folks, we're going to go see something that is not typical in pediatrics, and that is body work on a little baby that wasn't crawling. And some interned feet, the sort of thing a pediatrician would send to, maybe if at all, to an orthopedic surgeon who would probably reassure and we would watch. So let's go take a look at a pediatric body work in session to deal with something that pediatricians don't really think is a option. We've got a baby here who had some feet that kind of turned in a little more than you might expect. And you had a special kind of crawl, didn't you?
It's not nearly as bad as it was when we first started seeing Dee, but his head was like cocked in a, like to the left.
It was definite torticollis. He had a lean, it was locked, the back of the neck muscles along the back. And working with this age, people are like, how do you work on a baby? How do you do this? You work with them, just their nervous system is hypersensitive. And so when there is more development on one side than the other, or there's curvature, it's just gonna be a little more tender. They're gonna be tighter. So what happens when that tension pulls is as they start to develop, they may not crawl normal or want to stand or lift or pull. There's just a few things that it can affect. A lot of times they'll want to cross their legs so they get a stretch back here. He pulls in his ankles a little bit. And that's where I started doing this pediatric bodywork thing, was sometimes it does. So to hopefully maybe prevent something from being an issue down the road, I just basically show parents ways to stretch, ways to move, ways to massage, to sort of help them out, giving them something to do at home, because you're obviously not going to bring your baby in for a massage every day or even every week. So I'm just working down, wobbling. Do you want to go sideline? Yeah, sometimes that's another way to get a stretch in there. In general, for even adults, just that relaxation aspect, the central nervous system, calming the central nervous system. If there's a lot going on for them, a lot of kids right now have stress, anxiety, all those things. Just taking a moment. With this age, I call it a mini movers massage, because they're gonna move. They're not necessarily gonna lay there. But a lot of times that push back into it, the pressure feels good. So it's like their way of saying, give me more. So you're watching here, Doc's working on his feet. I trained him to do that. He does a really good job. Just kind of working with that tension. You can probably, Doc, can you talk about that? Like when you go to press, he'll probably want to push in, probably feeling that. So he's just gonna kind of work.
So parents will often, who have a club foot, now this is not a club foot, but where the foot is just like that, these tendons are all real tight in here, pulling. And most pediatricians will know that most of these things, if it's not an actual club foot, will loosen up and stretch over time and then get better. But as a parent, or if you have access to a body worker who knows how to work on kids, you can get progress by just gentle stretching and then little massage of the areas that are concerned. What Dee Dee's been bringing to our awareness is the ability to use some decompression.
So with decompression, what we're doing is we're working a little more superficially here. The lymphatic system is just all over this crazy little body. So when we put it on and we lift that up, we're basically working with the lymphatic system. And then once you increase one area of the body, the lymphatics, then that helps with that overall circulation effect. And kids, just, it seems to be much easier of a modality for the body, as you can see.
Yeah, he's living the good life right now.
Yeah.
Both legs getting worked on. You are
and
so
so
lucky.
In this area, even
Those
like
good
this
fingers.
is pulling, this kind of puts a strain on this muscle. Eventually, actually it is the tibialis anterior, but right through here, again, this is something that we can do. We cup, and this hand I'm stretching and helping him kind of go into. The body, even at birth, has muscle memory, and that's why for some babies there's some birth trauma that goes on and little things that get affected.
Yeah, you do.
Yeah, do you like seeing you?
He's
watch
going.
his little neck.
He's going. This is pretty cool. This is pretty cool.
Like, I'm gonna help you, Noah.
I think I want a massage where I've got two people, one on each leg.
I am have a little bit of FOMO going on right now.
This is like, yeah.
Well, and I mean, for him, your hands are giant. For us, it'd be like a giant was massaging us.
Massaged by a giant, two giants.
They're not gonna allow it if they don't like it.
Yeah.
No, he looks incredibly.
He's like
calm.
pretty content. Like, okay, I'll be able to crawl after this.
Well, and one of the last sessions we were working on him, and it was amazing. We put him back in his clothes, and he got up on his hands and his knees. Yeah.
Yeah, you're liking that, aren't you?
So this is, I'm just working on his spine. They do this at home for
He's in
him
this
too.
trance.
You can see those nice little pink spots. That's just sort of indicative of that I'm lifting this up and allowing for some of the lymphatics to move a little better and the blood flow. And most babies really, really like this, and it's proven in this case, this little guy, it's helped to really loosen up. I just have to think that when the fascial tissue kind of adheses to that muscle tissue, that's what's causing that tension. So if we're opening that up and loosening that, that's going to allow them to move a little bit better and have better growth.
And folks, being able to crawl is so much more than just the motor skill of being able to crawl. There's something very unique that happens when you have visual input while you're doing cross body movements like crawling. It actually does a lot for brain development that helps you in all sorts of other ways down the road for learning, reading, things like that. So how are we doing here? Somehow between those two fingers and just zoning out to this his eyes are drooping. He's falling asleep.
Can't tell you how many babies I've put to sleep this way.
That is hilarious.
And what's
He's
nice
falling
right
asleep
now with
sitting.
this position, working with them this way, is it's stretching it. It's opening it up and allowing him to just sort of relax a little bit. There goes that, and that's that part of that nervous system. Everything's calm. It's like my little fingers are telling his little body, everything's gonna be okay.
That is beautiful.
He's falling asleep.
He's out.
So I keep the heat on the table so that it's warm, and this is one of the ways I'll get to be able to work on their neck. I can lay them back. And do some neck work. Can work on kids when they're up in the lake, but around the neck and the head, we don't want to risk pushing on the nerves that run through the cervical vertebrae around the neck area. So you won't really see me ever pushing or working on the neck when they're sitting up. Doc is doing the same thing. He's working on those muscles real gentle.
So there are muscles that attach at the back of your skull, and that's a point where you'll often have tension. If you get tension headaches, babies are the same way. So I'm just gently rolling my fingers up and down along those muscles that go along the spine, right up to the point where they attach at the back of the skull. And it's just a gentle pressure. It feels good. It's interesting. If you've ever had a massage and somebody touches the back of your skull just at the right spot with just a gentle pressure, it often relieves a lot of tension. And
You're
feels
talking about the occipital ridge.
the occipital ridge. Thank you, Dee Dee.
Yes.
So you know your vertebrae go right up and down your spine, right down the middle, right? Well, that very last one kind of is your clue. That's where it attaches right to the skull. So I'm moving one of my fingers right to that spot, and you can just see we're peacefully asleep here.
So just the gentle work makes a difference, and Doc's actually doing this. I've trained him to do this before. When they're out like this, you can just shift a little bit and stretch a little bit. If at any point baby starts to pull or move back, then you just let him. You never go against what they're doing, but it's during this time that we're making the most difference in those muscles by relaxing those muscles. So when they turn, yeah, we just kind of let go. Craniosacral is a type of work. The work that I do is called cranial-occipital spinal work. There's also a technique called craniosacral, and we believe that with that cranial work, sometimes just that gentle hold, because of how many facial nerves and cranial nerves and basically everything from that brain is coming down that brainstem and into the spine. And they just can get tight. We can get cranky, we can get upset. A lot of that, we believe with the cranial work can help with just simply relaxing a child who gets really stressed or anxiety, or even with depression. With teenagers, having this work done can really make a difference, as you're witnessing.
So one of the techniques that I was trained by this master body worker, Dee Dee here, I used to think, doesn't look like you're doing anything. And my fingers are moving gently, but I'm also applying just the most gentlest amount of traction. And that's just, I can let go completely, or I can I'm holding the cheeks just to support the head, basically. And then with my middle and fourth fingers underneath the skull, I pull a teeny bit towards myself. Okay, so I'm stretching the spine, and it's not causing any discomfort, but that can release some of that tension because all those spinal nerves are kind of scrunched. You think about a baby being born, obviously this one's a ways back from being born, but you get pushed through the birth canal, there's a lot of compression happening. So you saw a little movement, I just release completely. Yep. So that, you're feeling with your fingers for any kind of tension that you might have to, if you're overdoing it, you release. Or any movement, if you're trying to put a tiny amount of pressure, just let go. Release back to neutral. And this is the work.
So if you leaving the babies right in that position, that can cause tension though if it begins to hold. Say if they're only leaning to the right or the left, and that's where the torticollis can kind of begin. Now, his neck is so different since we started working. It's just amazing being able to turn and move. It's made such a difference, and unfortunately there have been kids who don't outgrow it, and we've seen in adults where their heads will only turn one way. So the idea is we don't always know what's going to happen as they grow, so just doing mild things like this can help to prevent the tension as they get older.
I'm going to plant some little subliminal messages.
I'll be working on her feet while he's working.
Don't worry. Every little thing's going to be all right. That's right. Woke up in the morning. 3 little birds were at my doorstep, singing sweet songs, melody so sweet. They sang something like, don't worry about a thing, 'cause every little thing is gonna be all right.
Singing doctor. Did you know your dad can sing like that?
That was a Bob Marley song once upon a time. So folks, there you have it. Pediatric body work at its best. You gotta get this. I'm Dr. Paul.
Thanks, Dee Dee.
You're welcome.
Bye, little dude. Oh, he's already gone.
Yeah.
Bye for real.
Look at that. You gonna get that? You gonna get that? Come get it. Come get, look. Here we go. There you go.
After the work, I always try and test and see what we got here.
You gonna get it? There you go. Oh, we just crawled. We did a crawl.
Stay with it.
Stay with it. You got it. Come on. That was our first ever
Don't
crawl.
know how exciting this is.
Oh my gosh, you got your first crawl. You did it. There you go. There you go.
Can you get it?
Go get it.
Keep those legs. And remember, Mama, just
Come get it.
watching feet as
Come
he starts
get
to
it.
crawl. If the feet go
Come
in, just
get it.
correct it.
Yeah.
All yours. It's all yours. You can do it.
Do something cuter, baby.
Okay, get a little ducky. There you go. There you go. Come get the open glasses in the ducky.
Pull it back just up. There we go.
There we go. Ah! Oh, you almost got it. You almost got it. Quack, 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 quack. Quack, 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 quack.
Go.
You can do it. You can do it. We captured that one crawl.
Yeah, we got a little bit. What are you doing? I was checking your feet. What happened when I put you this way? Ready?
Go get it. Go get it. Go get it. Oh, we had a crawl there.
Yeah, he's like, yeah, no. That
That was the best you've done so far.
So, and like we talked about before, when his legs come in, when he's down like that, just kind of straighten them, and again, the muscle memory thing. And when he starts to do it in a way that we don't want him to, then we'll just put him down. Oh my goodness, this is amazing. He's moving. It's gonna take some time on those feet. Yeah. But the fact that he's scooting like that is great.
That's progress.
Yeah.
All right.
Okay.
I owe. It's off to work I go.
What? Look at you.
Okay, back
Look
to
at
work.
you. You did so good. So good, buddy. And, oh, nice catch.